everybody, and welcome to the Journey to Happy podcast. This is a podcast dedicated to educate, inspire, and motivate women and men around the world to think and behave in healthier ways. I am Olga, your host, and today I'm doing a special edition due to the coronavirus. When I was thinking about how could I best service the community, I realized that for me, what I have always been good at is staying helpful by providing information. And so today I'm hoping to share helpful information to you that is accurate and that you can put into practice immediately. I am joined by a nurse today, and she and I will be talking about the importance of social distancing. And I know there has been a lot of talk about social distancing, and many people are frustrated, and many people are not fazed by it. Yet, I think that this is a very, very important subject to talk about. And so does my guest, who I will be introducing shortly. So, she's going to explain to us the realities of the hospitals today here in Ottawa, and she's going to give us some tips on how to stay healthy and what happens when one of our relatives actually gets admitted into the hospital. So this is Nancy Sullivan. She is one of my favorite humans on earth. She was a student at my meditation studio, and now she is a coaching student for my Journey to Happy program. And she's the kind of student who does her homework. And in these times of crisis, when she's been called to work beyond her duties, I can see how she's been putting into practice everything that she's been learning. And she's also taking the time of her moments off to do videos like this one so that she can continue to help the community. So Nancy, I am so thankful for what you do every single day, but especially for the attitude that you have had throughout this crisis and how helpful you've been, and for taking the time to be here with us. Thank you and welcome.
Thank you, Olga. Thank you to you for taking the time to do this with me. I appreciate it.
This is very, very important. So one of the things, I should introduce you better. Nancy is a mother of two. She's a wife, and like I just said, she's a nurse. She is from Ottawa. She is always happy to help people. And it was not hard to convince her to be in this podcast with me today. And in fact, it was her who reached out to me in the last few days saying, like, this is the time to talk about it. So she reminded me of the interview. So again, Nancy, thank you. And if you want to say more about yourself that I don't know, feel free to reintroduce yourself.
I think you introduced me very well. I have been a registered nurse for 25 years now. And I have to say that what is happening now, I never thought in my wildest dreams that we would be living an event like this. Definitely not personally and neither professionally.
I agree. I think that's the feeling that we all have. We could have never imagined something like this. This was beyond our imagination capacities, which I think is what makes it so stressful for many of us, that we're living a reality that we could have never imagined could happen. So Nancy, why don't you give us the breakdown of personally what has happened to you over the last 3 weeks when Canada declared itself in an emergency, in a national emergency? What has that meant for you as a mom, as a wife, and as a nurse? What has happened?
I think as a mom and as a wife, it's happened to everybody, where we have to rethink how we're going to live. We have to rethink, well, first of all, is it really true? What do we need to do to help and protect ourselves? And I think professionally, it goes beyond words, what we are going through in the hospitals. I have to say I'm at the moment not in a critical area, so I'm not in an ICU unit and I'm not in the emergency room and the operating rooms. My background is in obstetrics, so dealing with pregnant ladies. I've worked in labor and delivery. I've worked in the clinics. and I branched out into a different field in the past 4 years. This virus, this pandemic, has created a big, how can I say it? It's created the health system to go upside down. In the clinic that I was working, I work at the Riverside Hospital, and it is a hospital that's called, that addresses outpatient care. Therefore, you don't get admitted, you don't stay overnight, it doesn't operate during weekends. Well, that hospital is almost not operating at all. I think it's functional at 10% at the moment. So a lot of our clinic and all of our work has been closed. We've had to all of a sudden call all of our patients and say, at the moment, we cannot see you. And therefore, that created what we call a redeployment. So all of that staff, I can't tell you how many people are in the hospital, but we have all been asked to go work somewhere else in a different campus, a different hospital, a different unit. That means we've had to be retrained, retrain our old skills, learn new skills, and learn new computer system in a very short time. It's created a lot of stress. As nurses, we all want to give the best care. And when something drastic happens so fast like this, we're always afraid that our care is going to be compromised. I mean, I can assure you will not be once you do walk in and you have to be admitted at the hospital. I can assure you that. But it's created a lot of stress among the personnel at the hospital.
So you're back to your initial training in obstetrics, and so you're lucky that way that you had some training in that area. Mm-hmm. But what you're saying is that there might be nurses who might be sent to the obstetrics when they've never done this in their life.
Exactly. Wow. That's exactly it.
And so what's happening with that hospital that is closing down, where the clinics are closing down? Those patients are not being reassessed anywhere else. They just were put on hold until we're past this pandemic.
Exactly. There are what we call home visit calls. And that means that the physician is calling them at home to see how they are doing and to see what advice they can give them over the phone. But as to when we will see them physically, we do not know. And then, of course, we tell the emergency what's an emergency and when they need to present to the emergency room. So they do have that service, but the Riverside Hospital is not considered, our campus is not considered a emergency hospital, right? So our services are non-essential at the moment.
Right, okay.
Even if they're considered essential for that clientele, and that clientele is having difficulty understanding why they cannot come and visit us for an appointment, they're not going to die from the lack of these services.
Wow. And so in the last 3 weeks, you went from working at this clinic in this hospital to then being moved to a completely different hospital, new system, new set of patients, new duties.
Mm-hmm. Yes. And every day my duties kind of shift and change. Oh, we need you this today, or today we need you to do that. Or, even sometimes I'm at one site and I get asked to go to the other site because it's busier at the other site.
We're doing this in preparation for an outbreak in our city and then just having mm-hmm. staff available in the event, or are we already seeing cases in the hospitals that are bringing our system to overcapacity, needing all this extra staff to come into the hospitals?
So both, I guess. I think we're very lucky so far in our region. We don't have too many cases that are in hospital, but we're trying to also prevent. So we're trying to practice physical distancing in the hospital as well, to have extra staff in the area that I am working in and the other areas, is to have patients to come to the hospital for a shorter time instead of a longer time, and to spread out the visits throughout the day. So instead of having a clinic open from 8 to 4, we're going to have a clinic open from 8 to 6, spread those visits, and even start the visit over the phone a few days before, so that when they do come to the hospital, we go down to business, we do the visit as fast as we can, as secure as we can, and then they go home.
Hmm. So that's how it's impacted you personally. Are you working extra hours? Are you being asked to work extra hours at this moment?
Yes. Yes. I'm a part-time nurse, and I've been asked to work full-time. And I will not be surprised if we're asked to work past those hours as well at one point if it becomes as bad as what they predict.
Nancy,
So weekends.
weekends and stuff. And like
Sorry.
you went back to shift work, where I know you were out of working.
Yes, I like a dream job of Monday to Friday, which is a wonderful event in a nurse's life once you can remove your shift work. At the moment, I'm still just doing days and a part of evenings, but who knows what the future holds, right? And if I'm going to be asked to go to even a more acute department later on, just because the staff is sick and they need more staff.
And you were saying, I think in passing, they're calling out retired nurses, retired doctors to come into the working force. And are they already in the hospitals? Are these people
Yes.
showing up? Wow.
Yes. Mm-hmm. And they even have a third plan if that doesn't work with students, medical students and nursing students.
Right, like what they're doing in Italy as well.
Mm-hmm. Mm-hmm.
That's incredible. So we are anticipating that this will be needed. We will need more resources.
Mm-hmm. And so this is very important, Olga, and I think that's why I wanted to talk about the physical distancing and how important it is, because really they call ourselves the frontline workers, but we're not the frontline workers. It's the community that is. It's the community that really needs to respect these rules of physical distancing to stay home. So therefore they are protected, they're protecting their family, their friends, and they are protecting the people at the hospital. Once coronavirus or COVID-19 virus arrives in the hospital, now the hospital has to deal with it, right? We're the last line workers at that point. And when the last workers are being affected and are ill, then what do we do, and what kind of a situation are we in?
Yes, so that's been the greatest motivator for me to have you come here, because I know how passionate you feel about it, and because you are what most of us see as the front line. And I'm so happy that you're revisiting that concept and making us have the awareness that it is us who are the frontline people. We are out there exposing ourselves, not knowing who's what, not having the right precautions, sanitary and otherwise, to not contract this virus. Something that I find has made me really personally aware of social distancing is the fact that anybody can have it and have no symptoms. So we cannot speculate like, oh, she's not sneezing, so I'm fine. I didn't touch anything, so I'm okay. And so why don't you dive in a little bit to explain to this audience social distancing? I know much has been put out there in social media, yet I am in a very isolated area right now at my college, so I really don't see or hear anybody else around me. But I see it on my social media, people going to their houses, to friends' houses, because they appear to be healthy. We all assume everybody's healthy. People are getting their groceries delivered, which is great, but who delivered those to your house, and what are you doing with that packaging? So what are sort of like what is the hospital recommending for people in terms of social distancing? Why is this so crucial for us, the frontline people?
So, a very good question. I think what we need to remember is there's no medication for this. There's no vaccine for this. It's not like a pneumonia, you take an antibiotic. It's not like you broke your leg, we'll do a surgery, we'll fix your leg. This virus comes into your body, And for some people, it goes out of their body without any big issues. Some people, the virus goes into their body and it just kills them. We have no medication for this. We do not have a vaccine. The only thing we can do is to stop spreading the germ. That is what we can do. And there are daily practices that can help to stop spread germs. You've heard about washing your hands. And I know for some people, it's just I take soap, I run the water, I just wash my hands. Count 20 seconds. Some people say sing the happy birthday song. But when you do count those 20 seconds, you realize how 20 seconds could be long or not long, depending on how you think of it. But it is very important. There are plenty of videos out there on how to wash your hands. You go between your fingers, you wash your thumbs, you wash the inside of your nails. Washing your hands is very important. You wash your hands when you wake up, every time you come out of the bathroom, every time you're sitting down to have a meal, every time you're touching garbage, meal, anybody else's plate. You wash your hands very regularly. That's one of the good things that you can do. You've heard about sneezing in your arm, coughing or sneezing in your arm. It's funny because now the coughing action has become like this big, oh my gosh, you just coughed, what did you do, right? I think everybody's become more sensitive to coughing. Avoid touching your face, your mouth, your nose. Very difficult to do. You don't realize it until you're told not to do it. And then, oh, that's itchy, or my eye's itchy, or, but that's very important. You will protect yourself by doing that. Drinking plenty of water is very important.
How come?
Getting
How come the water is so important?
To be hydrated and not dehydrated. They're realizing with the virus that having a hydrated body, that probably you are more immune to it and you respond better to it, and your organs are happier and healthier. This virus attacks your lungs and your other vital organs as well. So to be drinking plenty of water is very important. To take enough rest, to sleep enough, to take naps, whatever, but to try to prevent exhaustion is also very important. And practicing physical distancing, only going out when necessary. I'll go more in details with the physical distancing.
Nancy,
but those are what they're suggesting.
What's plenty of water? What should we be drinking? What amount?
About a liter and a half to 2 liters a day.
Okay, that makes sense.
Yeah, and of course, there are some people for various reasons, various health conditions that they can't, for their kidneys or their heart. Those people, they follow their doctor's suggestion, right? But the healthy individual, try to drink as much of water as you can.
Okay. So that's what we can do, like from our homes, whatever it is that we do go. For those people who actually have to leave their home to do their work because they're essential workers, this is very important to do. If everybody is washing their hands properly, if everybody's drinking the water, if everybody's not touching their face, which, by the way, how is that of a challenge with the mask when people are trying to fix them? Like, what are your thoughts on wearing a mask?
So it's a big discussion amongst us in the healthcare world. In the hospital, they're telling us to wear masks, but we are trained. We're trained how to remove it. We're trained how to put it on, and you get used to having a mask, therefore you don't touch your face. A person that is not used to a mask really has to concentrate and know how to put it on and know how to remove it without contaminating yourself. That's why they're telling people not to wear masks, is you are more susceptible of contaminating your fingers, your face, where your mouth, your nose, your eyes, than if you do not have one. Yes.
Okay. So what would be the safest way of removing a mask? Not touching your face, I guess, this way.
Exactly. So you're trying not to touch the actual mask itself too much. Don't touch the inside. When you're placing it, they're all different kinds of masks, but if it's the ones behind the ears, you're trying to grab the mask, place, the cords behind the ears. When you're removing it, you're actually bringing your face forward, like over a garbage can or wherever. You're placing your face forward, you're removing your mask away from your face by what's behind the ear without touching anything of your mask. But the moment the mask starts to touch you, touch your fingers, that's it, you've been contaminated. It's very easy. For people who wear glasses, those masks they interfere with your glasses. So then they get stuck. And then you're like, that's it, I've just contaminated myself.
So, okay, so people with glasses should not be wearing these masks?
Well, we kind of just know how to remove them and try not to have it touch your glasses. Mm-hmm.
And on the mask subject, I was going to ask you something. You remove them. Oh yeah, people who reuse them.
No, you're not supposed to reuse them.
Okay, so now people are home making their own mask with fabric.
Yes.
Your thoughts on that?
They're saying they're not as a protective device as the other masks. I know a lot of people, I'm seeing it everywhere on social media. I mean, your own mask will protect you, will protect the other patient,
from
like
you.
the other person from you, but won't protect, droplets or fluids touching your mask, because it's going to go through the material. Some people are putting filters. How long do they last? I'm not sure.
Okay. So in a way, this is me, but correct me, I think it's best to not wear this mask, because then I'm going to be far more aware
Yes.
of what's happening with my mouth, my hands and my mouth, than if I feel unprotected yet. It's like a fake protection. It's not really quite efficient, but it might give me a sense of just relax, Olga, you're wearing a mask, you're safe, and maybe not be as attentive to what's happening. Okay.
Correct. Yes.
That
is the message. Sorry.
No,
that is the message we're trying to convey.
So how about, is there anything else in protecting ourselves that you think?
So the physical distancing, that's the part I would like to really concentrate on. Mm-hmm. Physical distancing applies to everyone. I think people are not really understanding, because they're not seeing the how serious this virus is. But it is for every single person in Canada, in the States, other countries. We must be practicing this. It's basically you are avoiding contact with people. You're avoiding contact with people outside the family, the people you live with. So that means you need to stay at home. You need to stay at home all day, all night, as long as you can. You're trying to prevent from going out in the public. You're not using public transportation, no taxis, no Uber. You're not going out into public places. You're not going into public parks to meet together and play soccer or sport. You're not gathering in a parking lot and trying to socialize with your family and friends. You're staying home. It is very important. It is a very difficult thing to do, especially when we're so used to the busy lifestyle that we had 3 weeks ago. You're trying to keep away from seniors. Those are the people that are 70 years old and up. You're trying to prevent being in contact with anybody with a medical condition. That could be diabetes. That could be people with lung problems. It could be even the people that have what we call an immunocompromised system. So they are very frail to viruses and bacteria. You're only going out when you're going to the groceries, the pharmacy, or if you have a medical appointment. That is it. And when you're in the groceries, you try to do it as quick as possible. Make a list before you leave. Try to visualize where you're going and what you're getting ahead of time. so you know where you're going to go and not be in the store thinking, oh, what do I need to buy today? You know, you're paying with credit cards, Interac cards, not with cash, and you're in and out as fast as you can. And when you are in, you're trying to be 2 meters apart. Be very mindful of your distance. If you do not know what 2 meters apart is, measure it. Take out a measuring tape and see. I think some people think 2 meters is much closer to them than what it really is. 2 meters or 6 feet, depending on which system you're using. And when you are in a public place, it is very important to be mindful of your distance from people. When you're going out for walks, sorry, yes.
I also think that going grocery shopping is not a family event. I think that people in each household should pick one person who's going out to buy the groceries and let that person go. It is not a dating moment. It is not the outing. I know we all want to get out of our house, so it's like, oh, I'll come with you. I think that it's important that it's one person to go out, because I have seen people just taking photos with their mask at the grocery store. So now this phone is out. There's two people from the household, and it's like, God, you're not getting it yet. So just before we move on to like walking, because I'm very interested in what you have to say about the walking, grocery shopping. Do you have any advice as to what to do once you return home with your groceries? Or once you return home from a doctor's appointment, like what do you do physically other than washing your hands, drinking water? Is there any other precautions that we should have when we do have to go outside to a public place?
If you go even any public place, yes, I think you should come home, remove your clothing, and go wash it immediately. And you change everything.
Right.
So, some people, I hear some people change in their garage and then walk into their house and then go, you know, and some people just go straight into wherever their laundry room is, undress, and they throw it in the wash, and then they have another set of clothing waiting for them so they can change again. That is what I would recommend. For us, when we're leaving the hospital, we are leaving without the clothes we worked in. But I have like 2 sets of clothing to wash. I have my uniforms that I wear at the hospital, and I have the clothing that I've walked in the hospital to my car. And then when I get home, everything goes in the wash, and I go take a shower.
You take a shower, you wash your clothes. I'm guessing you don't greet people in your home until after.
No, they all are afraid of me when I come home.
You don't really, so it's like more like they're running away from you than you trying to protect them. They're like, see ya.
Yes. Yeah,
what happens
until you're all washed,
they'll say they'll acknowledge that you're home. So the grocery bags, like whatever, if people are getting food delivered to their home, what will be a good protocol to have with these bags of food and this food that is arriving?
There's all kinds of videos out there on YouTube. And I think the best thing, they say that it depends on what type of services, how long the virus can last on surfaces. Some people are putting their groceries in their garage. If you don't have a garage, they have maybe a cooler that they can put their stuff in for about 24 to 48 hours. I think that's what I'm doing. We kind of leave it outside for 24, 48 hours, and then we deal with it afterwards. You can give it a wipe, you know, of some kind of disinfectant, you know, cleaner. But that's what, and you have to be mindful that if you're taking so if you're coming home right away with it and putting it away, you need to be careful of where you're putting things, you know. So if you bought a carton of milk and you put it on your counter is contaminated.
No.
So I'm a bit, I don't know if I'm to an extreme, but they stay out, and then I disinfect my bags. You know, And I try not to put anything on the counter. So if I'm taking a carton of milk out of my bag, I'm disinfecting it and I'm putting it immediately in my fridge.
Are you wearing
But I
gloves?
can't tell you that's the perfect way. Or
Right. So that's what you're doing. Yeah. But
I
do
I
you
am
gloves?
not
Okay.
wearing gloves, because gloves, I know how to remove them, but that again is like a mask. You need to know how to put them on and remove them without contaminating yourself. And I have a lot of confidence in washing my hands for 20 seconds
Hmm.
before and after.
So you're taking these items out of your bag, you're disinfecting them, and then you're placing them in their place. And when you're done, you wash your hands.
Yes.
And what are you using to disinfect? What product are you using?
I use Lysol, but I don't know. There's all kinds of other products out there, and there's all kinds, of what people are posting. But apparently Lysol is good enough.
Okay.
To tell you the truth, Olga, who really knows? I'm not sure, right?
Doing our best.
Because without, as this virus keeps affecting people, it mutates as well. It changes. So we never know in the next week what is going to be effective for it. So that's why that physical distancing is so important, to stay home and stop spreading it. That is what our job is.
That's like, people want to help. This is the best way of helping.
That is the best thing.
Do your
Stop
part.
spreading it. Yes.
You
are the frontline workers.
Let's talk about the
Sorry.
walks, because people are going for
Yes.
walks, or they're going for bike rides, which I encourage people to move in a safe way. But I would love to hear what your thoughts are about this walking, and like, what does that look like in the city?
So it's always 2 meters or more apart when you're walking. I actually took out a measuring tape, went to where the sidewalk was, and what is 2 meters. I physically wanted to see the actual distance instead of trying to approximately measure it. And if you're walking and you're meeting another person or a couple or whomever, people are supposed to go away, supposed to take their distance.
Yeah,
Either you cross the street.
You should never do this passing.
No, it's always 2 meters apart, always, for everything. I go in the middle of the street.
That I was gonna say that. So for people who haven't, maybe they want to have a visual. I saw your photo, and you had one person on the beginning side of the sidewalk.
Yes.
And 2 meters was past the sidewalk at about maybe 1 feet or 2 past the sidewalk.
Correct. So the sidewalk is not 2 meters. The length of the sidewalk is not 2 meters. It's longer.
Yeah.
Yeah.
So it's okay to go for walks as of right now. We are allowed to go for walks, unless you have just returned from a trip, unless you're feeling sick.
Yes, correct.
Is there another condition to not going for a walk?
Unless your physician told you not to.
Right. Or if you were in contact with somebody who was supposed to be, who just came back from a trip, or who had some symptoms.
Yes.
Of a cold.
Mm-hmm. Yes.
I have heard people going to visit their friends or family members because I know where you've been and I know where I've been and we're all healthy, so let's just have supper together.
The moment you exit your home, you're now in what I would call the danger zone. Without creating a paranoia, you have exposed yourself the moment you leave your house. So by leaving your house, if inside your house everybody's all symptom-free, everybody's healthy, you've either done the 14 days quarantine or you never had to do it and you're practicing physical distancing, the moment you exit your house, you are now
at risk of infecting somebody or
yes,
infecting yourself.
Yes.
And people feel healthy, right? So they're like, I'm fine. I haven't been in contact with anybody. Like, I have not left my house for three weeks, other than for walks around here in nature, surrounded by my property. Like I haven't gone out, but my husband
Yes,
has. So I can't say that we're totally house free
exactly.
household because he goes to buy groceries and we take some precautions, but you will never know until you're sick that you actually got sick on that outing.
Exactly. And now they're realizing that the virus is not just from someone who's traveled, it's now in the community. That means people are contracting the virus without being in contact with someone that has traveled. So that means the virus is now out there on surfaces, wherever it can stay alive, and some people are getting sick just that way.
Bah.
Mhm.
All right. What
Mhm.
can we do to keep our immune system healthy? Regular human
Okay.
beings who may not have an underlying condition, what can we do to stay? We'll drink water for sure, the 2 liters or the liter.
The water, they say exercising every day, so taking a walk is very important, and eating well. What is eating well? Well, that's a whole new ball game of a conversation, but it is very important to try and eat well. So it's rest, hydrate, take some fresh air, exercise, and try to eat well. There's this thing about vitamin C, but I haven't really researched a lot about it, and I don't think we know too much about this virus so far. So I wouldn't talk about supplements or anything like that because I'm not there's not enough evidence out there.
Right. So whatever supplements you were already taking that you know help your immune system, keep those up. But we
You
don't know
continue.
with deficiency that vitamin C specifically helps with this virus.
Yes.
We are always worried about somebody in our family. So we may all be connected to somebody who qualifies as those people who have been impacted the most by this virus. Like, look at Italy, they've lost a generation pretty much, which is incredibly sad and painful for their nation. And I can think of my parents and I can think of people I love who qualified as having an underlying condition. What happens to these people once they're hospitalized? What if we have a relative who happens to need that hospitalization? Can you walk us through that, Nancy?
I can. I mean, it's um, I'm not in that type of care yet, but first of all, the hospital has a no visiting policy. The moment you are hospitalized, you're admitted in the hospital, you cannot see your family members anymore. So whatever illness you're having, you're going to get through it on your own. If you are tested, if you do have a positive COVID-19 test, that means you're basically getting people in all their full gear, the Martian gear that people call it, right? So they have a mask, they have a gown with a mask with a visor, a hat, a gown, and gloves. And there's a whole process in putting that outfit, and there's a whole process in removing it. And so it takes minutes to do that process. You go from washing your hands, and when you're removing it, you're washing your hands 3-4 times in between each removal of the equipment. So if you're in the hospital, to get a nurse to come into your room, or a physician, or an RT or physiotherapist, whomever, a healthcare provider to come into your room, they all have to gown, and there's a ritual in that gown, in that process, and it takes a lot of time. So you're alone. You do not have your family besides virtual technology. And it takes longer to have a healthcare worker come in the room to care for you.
And again, these workers might or might not be trained in that particular.
Well, yes, well, we are all trained. We don't use it as often until now, right? We're all now getting very good at because even in the hospital, you're greeted from those workers as well. So in the hospital, you get screened, you get asked all these questions. And when you get on your unit that you're supposed to go visit, you get screened again to make sure that that's what, to make sure you are an appropriate person. This is if you're coming for an appointment. If you're already being admitted, well, then you're in a special room, isolated, and you have the healthcare professionals are in their protective gear. The sad thing about the no visitors part, so like I said at the beginning, there's no cure. We do not have medicine for this. We can only help your symptoms. So a fever, Tylenol, puffers for having difficulty breathing, But a lot of people that are admitted at this point are in the intensive care unit or a critical care unit. That's where our COVID positive patients are at the moment. And we're just trying to treat the symptoms, but we cannot treat that virus. So it's going to be a war zone with your body to figure out if your body can fight it or not. And yes, there's a certain age group that's affected the most, as we're hearing about residents for elderly people, but there are some young ones as well that are having difficulty fighting it. So it's very important to not be cocky about your age, and think that you're young and you'll be able to fight this.
I love that. I did a live on Instagram about this because I saw this woman from this CBC News posted, a woman who I assume was about my age, in intensive care, having such a hard time breathing, just talking to her coworkers initially to please take this virus seriously, regardless of her age. She didn't have any underlying condition yet. Her body had a really difficult time fighting this virus. And so, not to say that she was not going to make it, she made it, but she needed to be hospitalized. And so I think that that's something that nobody can walk confidently thinking, I'll just be at home and I'll be fine, because Tom Hanks is in his basement and he's fine, right? Mm-hmm. Like you have no idea how your body's going to respond. I think you touched on a very important, like I got watery eyes to think of getting sick and not being able to be with my baby for 2 weeks or 3 weeks, for example. That'll be life-changing for my little son. And so it's very important for people to understand that once you are hospitalized or somebody you love, that you will not be able to see this person, and what that impact that could have within your family. If that does not motivate you to stay at home, I'm not sure what will, but it's not an exaggeration when we're saying we're saving lives by staying home. Yes. So I think that's very crucial to understand.
I have other examples of hospitals by not having a no visitor policy. So we're talking about going through your illness alone. We're talking about labor and delivery. When women are coming into labor, they're coming in at the beginning of their labor alone, and their husband or partner can only join them once they are in real active labor. And if they do not have a natural birth, they have to have a cesarean section. The partner is not allowed in the room.
Having gone through that recently, I couldn't imagine being in that room by myself. It's terrifying.
And our babies that are born premature do not have their parents with them all day to comfort them or to hug them or to, the parents can only visit their babies once during the day, and it's one parent at a time. And this is, for me, the most difficult one, that people are dying alone without their family members around them. That, for me, is a very difficult one to swallow. I have not personally seen yet what a patient that is COVID-19 positive. I've only heard stories, but just the fact that we have that having no family members to help you through your hospital stay is beyond my wildest dreams. And so I think people out there that are not believing how serious this is because they do not have a family member, right, that is in the hospital. They don't have a little child that's gone to the hospital. Even for children, you cannot follow your child to the hospital if that child is hospitalized, right?
For whatever reason, not just coronavirus. Let's just think about
exactly
your child
appendicitis.
Exactly, like you're not going to be with your kids. You're
No,
not going to with your partner, with your grandparent, with your
no.
niece, nephew, with whoever it is that you are
Mhm.
close to that might need your support.
I find this is kind of like mental illness because you're not seeing the impact, you're not necessarily believing it, right? But if your prime minister or your political leaders come live every day, um, in if they sorry if they come live and give you a speech every day on staying home, I don't know also what else is there when your leader of your country, regardless if you
Of
like
your
that person or
political
not,
party, I agree.
let's remove our political, differences here. That political person, that our leader is telling us, and that person is being guided by a group of professionals telling all of us to stay home. I've never heard of this, right?
Not
I
only
don't
that,
know what
Nancy,
is.
they're providing assistance to every single Canadian financially so that
Hmm.
if you're impacted by this, there is going to be something that you can qualify
Hmm.
for. I know small businesses and businesses may be listening to me say this and be like, not us, we don't qualify. I think that
Hmm.
every single person in Canada has an option so that we can all remain safe and keep our
Hmm.
community safe. So we're coming up to an hour chatting, Nancy, and I know this is your day off, or you might have to go into work. I don't know, and so I don't want to take a lot more of your time. How are you doing? How are you doing to take care of yourself? And most importantly, other than staying home, how else can we support you?
You can support me by staying home. That is all I'm asking. Seriously, just stay home and do not visit anybody unless it is a life threatening situation. How am I dealing with it? I think I have my moments like everybody else. But there's a few things. I have a ritual that I do when I wake up in the morning. So I meditate for about 10-ish minutes. I also have practiced gratitude. I have a journal that I write what I am grateful for. I try to find at least five things every day that I am grateful for. I also practice trying to just live today, being mindful. So I do get this stress ball in my stomach sometimes about the future, especially at work. They try, we always have a plan A, B, C, and D. And so when you're hearing all of these plans, that means it's because the phases, everything's getting worse, right? So then you get a little stress. I get a little stress ball in my stomach. And then I just try to come back to like what I'm living today, that today I'm here, today I'm healthy. And when I come home from work, I try to do something that really helps me relax and makes me happy. So when I go to bed, I can say that, I had a wonderful evening. So it's whatever TV show, whatever I'm reading, whomever I'm talking via FaceTime. I also exercise every day. And during the weekdays, I would say I try to eat well.
Weekends are a free for all.
I love my cheat days as well. Um, and by being a member of Journey to Happy with you, Olga, absolutely, I do not think a year ago I would have had all of these coping skills and that I would have been mentally ready for this pandemic. And I truly feel that, I can handle this one day at a time.
Thank you, thank you, thank you, Nancy. I am so happy that one, you have the tools to cope because we need you guys helping us go through this. We're relying on you. We're all cheering you. And from this conversation, I know that I keep thinking, how can I support you? I have come up with a really low fee to support frontline workers, all kinds of frontline workers. But what I'm getting out of this conversation is the real help is by stop spreading this virus so that we can all return to
Mhm.
our normal lifestyles, so that you can return to your old job, and we can all return to this place of safety where we didn't have to think twice about going to visit our grandparents, where we didn't have to
Mhm.
think twice about mm, mm, everything touching our face, and whether or not everybody we love is going to stay safe and healthy. So,
Mhm.
from the bottom of my heart, I want to thank you so much for coming out to this interview to help us and understand better the impact and the importance of social distancing. I am so happy that I am a part of your journey and you're a part of mine, because we have had experiences that I think help us both be in this moment in time with an open mind and understanding better what's best to do for our community. So, for you guys listening, if you have any follow up questions, you can either write them on my review box at the Journey to Happy podcast, or if you're viewing this on Facebook, you can just write your comments below, and both Nancy and I can go in and answer them. But I really hope that if you find this helpful, you can share this video with whoever you think needs to listen to it, because that's what it's here for. We're just trying to spread information that is helpful. And stay tuned for my next guest, because I will be having um, quite a few people coming over to just share with us their gift. So Nancy, thank you so very much, and I'll talk to you very soon.
Thank you, Olga.